In today's video, we're going to talk about Medicare changes in 2025. We're going to point out seven changes that you need to be aware of. So stay to the end of today's video. So let's get right into it, okay? First, let's talk about the annual notice of change. This is the letter that you should have gotten from your insurance carrier. So if you're on a Medicare Advantage plan, you would get this letter. And if you're on a standalone drug plan, you would get this letter as well. So what is the annual notice of change letter? It basically outlines the changes of your plan for the following year. It's going to show you what you have in 2024, and it's going to compare it with 2025. So it's going to be very important not to throw away this letter and to make sure that you compare the changes. If you're happy with the changes, then you're good to go. Your plan will automatically renew for next year. It's going to be very important for everyone to look at your letter this year. Pay attention to it because, like I said, there is a lot of changes when it comes to Medicare, and you may want to go ahead and change your Medicare Advantage plan or change your drug plan, okay? Now, let's talk about the first huge change that is coming in 2025. Number one is some plans will completely come out of your service area, okay? Some plans will completely come out of your service area, meaning you will have to actually look for a brand new Medicare Advantage plan, okay? This is called a SAR letter, Service Area Reduction. That means they're completely coming out of your area. So if you get this letter, then you would know that your plan would no longer exist for 2025. And unfortunately, you will have to go ahead and look for another plan. Now, there's some great news with this. Number one, you could change your plan to a new Medicare Advantage plan. You definitely want to do your research and talk to a broker that you trust that can help you navigate that. Our office would be more than happy to assist you with that as well. You want to look at your medications, your doctors, any special treatment that you have going on, or you're on oxygen, etc., to make sure that you do go ahead and move on to a plan that really meets your particular needs, okay? Another thing that you definitely want to be aware of is that if your plan is coming out of the service area, you have a new opportunity to get on a supplement plan, okay? So if you have any like health concerns or chronic conditions and you wanted to get on a Medicare supplement plan, but you couldn't because of underwriting, well, you have an opportunity, a special reason to go ahead and enroll in a Medicare supplement plan. Now, a Medicare supplement plan works a little different than a Medicare Advantage plan. The Medicare supplement will pay the 20% that Medicare leaves behind, and you could go to any doctor that takes original Medicare. So you may want to go ahead and enroll in a Medicare supplement plan instead of getting back on a Medicare Advantage. So definitely keep that in mind, that you can also decide to enroll in a Medicare supplement versus a Medicare Advantage. You could only do one or the other. So you would get on another Medicare Advantage plan or get on a Medicare supplement plan. So good to know. And if you do get on a Medicare supplement, don't forget you also need to go ahead and enroll in a standalone drug plan. Please take a moment to like this video. Give it a big thumbs up if you are enjoying the content. It really helps others to find this video, and it helps the channel a lot. Thank you so much. Moving along. Now we're going to talk about change number 2. And this is the Inflation Reduction Act, okay? So the Inflation Reduction Act was put in place for 2025, and there are going to be some changes when it comes to medication costs, okay? So prior, the max out of pocket for medications was $8,000, okay? So individuals that paid a lot for medications, their max was $8,000, which can be a lot. Most individuals, however, do not pay that much when it comes to medications. So what's going to happen with the new law, with the new changes, is that everyone, medications would be maxed at $2,000. So what does that mean for everyone involved, okay? Because you may be taking medications that's $0. You never had to worry about a max, right? So it's going to affect everyone involved, all Medicare beneficiaries, okay? So we're going to break it down into two parts. First, let's talk about Medicare Advantage plans. So if you're on a Medicare Advantage plan, most likely your prescription drug coverage is included in your plan. It's going to be very important to look at your plan for next year. Look at, do you have a deductible now? You may have a deductible up to $590 for the year. And then after you meet your deductible, then your max would be $2,000 overall, right? So $2,000 total, including your deductible. So it's going to be very important to look at your medications and see, do you have to meet a deductible before the plan kicks in and pay for your medications? Now, in most cases, if you're taking medications on tier 1, tier 2, then you may not see a difference. Your copays may still be $0, or you may have a small copay, okay? So it's going to be very important to look at the cost of your medications and look at the plan overall, your benefits. Are your copays still the same? Are you paying a little more for a specialist visit and such? You should see some changes here and there because of this whole change with medication costs. Now, if you're on a standalone drug plan, it's going to be very important to review your drug plan as well. Most likely your monthly premium for your drug plan will increase, okay? So if you're on a $0 drug plan, most likely that would no longer be the case. Most likely you will have a monthly premium. All of this will come out October the 1st, okay? Everything will come out to the public and you will know exactly how much your monthly premium is. However, like I said, there's that annual notice of change that you should have in the mail. So you may know the changes before October the 1st. You should have that letter coming into you by the end of September. So you want to look at that. It should outline the new monthly premium for your drug plan. And you may want to change your drug plan to a whole nother company. So it's very important to look at all of that when it comes to drug costs, okay? So yeah, that's the second change. Okay, so the third change is going to piggyback on the drug costs, okay? The third change is now Medicare is going to have an option where you can actually spread out your payments for your medications. So this is a new prescription payment plan, and this is an option, so you do not have to enroll in this prescription payment plan. But if you're paying a lot for your medications, or if you're one of those individuals that paid up to $8,000 last year, then you may want to go ahead and enroll in this prescription payment plan. This is going to help spread out your payments throughout the year. So if you're thinking you're going to pay $1,500, $2,000 for your medications, then it may be a great option that you go ahead and opt into this payment plan. So how will this work? All of the details are not out quite yet. However, I do have some information that I can share with you. So Medicare is going to offer you a payment plan option where you can enroll, and what it's going to do is help spread out the payments. It's not going to help you save more at all. Okay, so if your max is going to be $2,000, then your max is going to be $2,000. What it's going to do is just help you spread out the payments throughout the year, so that way it's a little more manageable for you when it comes to your medications. Now, if your copays are $0, $3, $5, then it makes no sense to really enroll into this payment plan. But if your medication cost is going to be quite expensive and you want to kind of spread out the payments, then this is a great option. So yeah, you're going to want to reach out to the insurance carrier that you choose for your Medicare Advantage company or for your drug plan company and enroll in the payment plan. When you go to pick up your medications, you would not have to worry about any copays. You will make your monthly payments to the prescription payment plan program. Okay, so that's how that will work. So I think that could be very beneficial for individuals, like I said, that will pay a lot more for your medications in 2025. The fourth change we're going to talk about is mental health services. So Medicare is going to be expanding and helping individuals manage their mental health and well-being. This is great news that Medicare cares about your mental health. So I'm going to talk about how this program is going to work for individuals that need assistance with mental health. I'm going to read this straight from the Medicare and You book 2025. So let's get right into it. So it says, managing your mental health and well-being. Medicare covers expanded mental health care, like extensive outpatient programs, services in certain locations, and services from marriage and family therapists and mental health counselors. Okay, during your yearly wellness visits, your health care provider can also use a health risk assessment to better understand your social needs. So during your wellness visits, your doctor can do a risk assessment and determine if you need help with mental health and provide you with extra resources that can help you with counseling services and such. So that's a great thing that Medicare is providing more services for mental health. Now let's talk about the fifth change that Medicare is providing. Medicare is providing more resources for caregivers, okay? So caregiver training, more resources to help you stay healthy at home when it comes to caregiving and caregiving resources. Let's read exactly what it says in the Medicare and You book. It says, more resources for caregivers. Medicare covers additional caregiver support, like training that helps your caregiver better care for you, okay? And relief when you're caring for family members and hospice care, okay? So Medicare will actually provide respite services for individuals that's on hospice to help relieve caregivers, which is really nice. So yeah, so Medicare is expanding more benefits for resources for caregivers. So if you need this type of care and assistance, then I would definitely look more into this. It says that some people living with dementia and their caregivers may be able to get more support through a new pilot program that's coming out in 2025. So this is great news that Medicare is helping individuals with caregiver support. So that will be coming out in 2025. Let's talk about the sixth change when it comes to Medicare, and this is for individuals that work for the Postal Service, okay? So I'm going to read directly what it says in the Medicare and You book. So here we go. It says, Postal Service's Health Benefits Program, starting January the 1st, 2025, the U.S. Postal Service employees, retirees, and their families will get their coverage through a new benefit program instead through the Federal Employee health benefits program. So if you are a postal service worker, then you would no longer get benefits from the federal program. You would get it directly from a new benefit program, right? So instead of getting it from the Federal Employee Health Benefits Program, you would get this. It says from a new benefit program. All of the information is not out quite yet. So yeah, so it's very important to know that it is going to be changing for U.S. Postal Service employees, that you probably will have to enroll in Medicare Part A and B and pay for Medicare Part A and B. But there are going to be some changes when it comes to your benefits. So yeah, now let's talk about the last change. And the last change is going to be geared towards telehealth, okay? So what is telehealth? Telehealth is when you can get services from your doctor via a Zoom, via your computer, via your phone, meaning that you don't have to go directly into the doctor offices to get care. You can get it at the comfort of your home. So Medicare have decided that telehealth services will only be provided in rural areas, okay? But there are some other areas where you can still get telehealth benefits if you fall under this category. And I'm going to read it because I don't want to miss anything, okay? So some of the areas will fall where you can still get telehealth services is going to be monthly end-stage renal visits. So home visits for dialysis care. So if you have end-stage renal disease and you need home visits and home dialysis, then you will still be able to utilize telehealth services. Services for acute stroke. So if you had a stroke, you was in the hospital, you get home, then you can still get telehealth services for services when it's related to acute stroke to help manage those stroke symptoms. So you can still utilize telehealth in those situations. You could also use telehealth to help with services that treat substance use disorder, mental health, and behavior health as well. So for mental health and behavior health, you can still utilize telehealth services. And diabetic self-management training. So if you need training when it comes to your diabetes, you can still utilize telehealth to get those training, which is really nice as well. The last thing would be if you need nutrition therapy. So you could talk to your dietitian via telehealth services still. So still some great benefits, still some great things coming out in 2025. We want to keep you informed. So I hope you learned a lot in today's video. And if you need any help with any of these services, helping you find a plan and such, give our office a call. That is what we specialize in. We love helping our clients understand Medicare and helping them find the plan that best fits their needs. It doesn't matter if it's a Medicare Advantage plan, Medicare Supplement, or a standalone drug plan. We're here to help you all year round. So yeah. Thank you so much for watching today's video. I hope you learned something new today. If you like the video, please give it a like. And if you know anyone that needs this information, please share this video. If you have any questions, leave them in the comment section below and I'll be more than happy to answer your question. If you need any assistance, give our office a call. We'll be more than happy to assist you. At the end of today's video, there are 2 videos that you can also watch. Thank you so much for watching. Please subscribe to see me again, and I'll see you on the next video. Thanks for watching. Bye.